The Minister for Health, Kwabena Minteh-Akandor, has updated Parliament on recent spike in COVID-19 cases at the University of Ghana, assuring the public that the situation is under control and there is no cause for panic. Mr. Akandor also reported ongoing surveillance of other health threats, including seasonal flu, cholera, and Mpox, with 133 confirmed Mpox cases but no death. Let's watch a video on that.
Right, Honorable Speaker, thank you for the opportunity to update this House on the recent development at the University of Ghana that has attracted national attention. The Speaker, while COVID-19 is no longer regarded as a global health emergency, it has not disappeared. In recent weeks, our National Disease Surveillance System detected an increase in cases at the University of Ghana. These cases have been traced to a familiar variant, the Omicron subvariant, which we have managed before. It spreads easily, but fortunately, it usually causes mild illness. Mr. Speaker, the recent COVID-19 cases are localized at the University of Ghana community only. I'm proud to inform this House that the cases were detected through Ghana's influenza surveillance system and confirmed by the Noguchi Memorial Institute for Medical Research. Ghana has continued to integrate COVID-19 monitoring into its broader surveillance of respiratory viruses. This foresight and commitment to preparedness allowed us to detect the current outbreak easily and respond swiftly. It is a clear demonstration of Ghana's leadership in maintaining vigilance even after the end of the global emergency phase. This should reassure all Ghanaians that should there be any cases outside the university campus, our surveillance system remains active and ready to detect and respond effectively. Mr. Speaker, as at now, 316 suspected cases, 107 of those cases have been confirmed as COVID-19. Fortunately, Mr. Speaker, there are no hospitalizations and, more importantly, no deaths. Mr. Speaker, so far, the outbreak is limited to the university community. It has not spread widely to other parts of Accra or the rest of the country. As I mentioned earlier, all confirmed cases are recovering well. Mr. Speaker, after sending a team to investigate, we found a few key issues that fueled the spread. The biggest factor was the recent hall celebration held in the university. These events brought large crowds together with little use of face masks or distancing. Following our investigations, even after the university community became aware, we also noticed a drop in adherence to basic COVID-19 safety protocols and some challenges with contact tracing. Mr. Speaker, once the first signals came in, we issued alerts to all health facilities nationwide. The university suspended all hall week activities, launched a campus-wide education campaign using posters, campus radio, and student leaders. Additional steps underway include supporting Lagon Hospital and Student Clinic with more resources, preparing the Ghana Infectious Disease Center to handle severe cases if any occur, providing more PPEs and training for frontline health workers, enhancing our data tracking in all health facilities, including mapping where cases are coming from. Mr. Speaker, I wish to clarify that COVID-19 vaccination is no longer part of the country's routine immunization program. Indeed, this is the case in most countries. That said, vaccinations remain one of the important tools that can be used to control the spread of COVID-19 infections, and more importantly, prevent severe disease and death. As a result, and in preparation for potential surge, we have initiated the necessary processes to secure vaccination in country. This is in line with our policy to protect the health of vulnerable populations, particularly people with underlying medical conditions and the aged, who are more likely to develop more severe disease. Additionally, I wish to assure the public that treatment is available for COVID-19. Paxlovid, an antiviral that is taken twice a day for 5 days only, is recommended for patients with mild to moderate COVID-19 who have comorbidities such as diabetes and hypertension. Treatment for those who get infected is based on symptoms. Most people recover at home. For more serious cases, our hospitals are prepared and stocked to provide oxygen therapy and all the necessary care. Mr. Speaker, let me also mention that we are seeing a rise in seasonal flu cases, as we do have during the rainy season. These flu symptoms, fever, cough, sore throat, can look like COVID-19. So we urge anyone feeling unwell to go to the nearest health facility. Also, though the number of cholera cases are down, we are still reporting cases, especially during this raining season. Some of the risk specific to COVID-19 some of the risk factors for cholera lie beyond the health sector. We urge all to wash their hands with soap and running water, eat food that is hot, and drink potable drinking water. As of 29 June, we had confirmed 133 cases of mpox, mostly in the Western, Greater Accra, and Western North regions. There are currently no admissions, no deaths associated with mpox outbreak to date. Additionally, except for the cases confirmed in the past week, all affected individuals have fully recovered. And we all need to stay safe, avoid close contact with anyone with symptoms suggestive of mpox, which include fever, rash, headache, and swollen lymph nodes, and protect ourselves by washing our hands regularly with soap and water. I must add that most of these universal precautions apply to both flu and COVID-19.
What is your take on the hospital letting the affected persons go without quarantining them? Do you think this can cause the virus to spread easily? Share your thoughts in the comment section. Don't forget, this is news on WIDERmedia. Stay tuned for more news.